Today's COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price but stay for the service.
And welcome back to Open Your Eyes. We're moving now into our first segment, update on COVID numbers. Once again, thanks to Fulltech System for providing us with this segment. COVID numbers, vaccines to be received in April. Now, this COVID-19, of course, once again brought to you by Fulltech Systems. In to talk to us about it, though, is Dr. Melissa Diaz-Musa, who is the Acting Director of Health Services, and also Lorna Perez, Surveillance Officer at the Ministry of Health. Good morning and welcome to both of you. We hope that you're feeling warm.
Morning, thank you. Thank you for having us.
All right, so let's jump on directly into this conversation. The numbers for active cases for coronavirus in our country, they look promising. They look very promising, but we've been through this a few times, and whenever we feel this way, everybody seems to be, we've got that mentality that we could just relax now, man. We could take it light. It's only 200 and something. We came from 3,000 and something. What are the feeling like right now within the Ministry of Health? Let's start there. What's the feeling like?
Well, like you quite rightly said, we're happy with the numbers coming down, definitely. What we're mainly concerned about is that the general public get very relaxed, feel as if we have gotten over COVID-19 and it's no longer a threat. So we really want to remind the general public that even though things have been going well, the public health measures have been working and people have been taking on some responsibility, now is really not the time for us to give up on practicing these public health measures. Now is the time for us to ensure that we increase the measures, that we educate our friends and family, and that we protect our vulnerable. So we are optimistic, but very cautious about it. We still have almost 300 active cases. There is, that can very easily turn into a lot more if the public health measures are not taken seriously. And we are definitely not out of the woods, and it can lead to a third wave if we let our guards down. So we've heard about COVID fatigue, and I do know that many people, because they've expressed it to me personally, we're tired of being locked up, we're tired of staying at home. We want to be given more freedom, we want to be able to go out to work. And so that's a part of human nature, and it's understood, but we really need to take on the responsibility and ensure that we continue as best as possible to practice what has helped us over the last few months.
Dr. Musa, what is working? And I'm saying this because COVID-19, while we had a curfew from 8 p.m. to 5 a.m., COVID-19, day or night, it doesn't matter. And do you think that the public have got a stronghold on and now starting to understand how severe the situation is, and this is the reason why we're actually holding off from being around each other? What do you think is working?
Well, I think definitely it's multifactorial. The restrictions that have been put in place in December, that had been put in place, definitely worked. A curfew does work because it reduces people from socializing. It ensures that persons are at home in their own, among their own family before a certain time, because if curfew starts at 8, you would have to leave earlier in order to be at home and safe. So a curfew, it's not necessarily that it won't spread during that time, because we do have people who work in essential services after that time. But it definitely reduces socializing and letting our guard down. And other measures as well, the public health measures like proper wearing of your mask over your nose and mouth, social distancing, physical distancing. And in addition to that, the strategies that we have implemented with testing, rolling out mobile testing, testing high-risk groups, detecting the case early, isolating the case very early. All these things have really helped for us to reduce our numbers. But, as things open up a little bit more and as people become more relaxed, numbers can go up. So it's something that we monitor quite strictly.
I'd imagine it's cautious optimism at this point, because you do have to ensure that whatever movement people can now do that they will still be adhering to all the protocols. Let's zone in for a moment into the testing. There has been an immense amount of testing done in the past 2 months. I understand that was a part of the strategy in being able to mitigate the number of cases we've seen. So do you have an idea of what coverage we've had so far, and how sustainable is it moving forward?
Yes. Well, initially at the beginning of the cases in Belize, we were focused a lot on testing close contacts and symptomatic persons. Mm-hmm. As the numbers started to come down a bit, we expanded this to do going out to different villages, going out to places where people might not have easy access to flu clinics and to hospitals and to polyclinics. So we went out in mobile teams to try to increase the uptake of the test. Mm-hmm. And this was successful for a few weeks. I know up north on some days they had 100, 125 persons accessing the mobile clinics. And as the days went on and as the weeks went on, we noticed that there was a decline in persons coming to do the test. Mm. And there were many reasons for that. Definitely, people were not as ill. People decided there was more than likely a fear element as well that we had to address with health education. Mm-hmm. And once we've noticed that the mobile clinics weren't as busy as we had wanted them to be, we took another strategy, and we actually looked at high-risk groups. So high-risk groups, construction workers, people working in immigration, people working at customs, grocery stores. So any groups that deal with a lot of the public. And we went in, discussed with the employers and with the supervisors, and we've had a good feedback from that. Mm-hmm. So that's where we are now. We're at an expanded high-risk group testing that has been very successful for us.
And so what I'd imagine the goal is here is to get as many of the asymptomatic cases out of public interaction so they don't continue spreading.
Yes, absolutely. And even persons with mild symptoms who may otherwise think that it could just be allergies or something of that sort, they're encouraged to test as well, so that they can be isolated, and so that we can ensure that they are not spreading to the workplace.
Doc, and we'll be getting Lorna in just a few, but
Lorna.
Doc, in terms, Lorna, yes, I'm so sorry, Lorna. But Doc, in terms of the accumulation of numbers, previously these numbers were coming only from the Ministry of Health. Is that the case right now? Are we getting these numbers from all facilities? We're talking public and private?
Yes, we have been collaborating with private sector from the rapid testing drive started. And many private sector facilities have been testing as well, especially in the Belize district in early December. And throughout. And yes, we do get data from all the private facilities through a different tool that Ms. Lorna could probably expand on. But the data includes private and public testing.
Okay. All right. So let's take a look. I know we have some numbers to look at this morning, and it really helps people to understand how far we've come and where we don't want to go back to. The measure that's often used is what they call the rolling average. So we don't go the day by day and see it up and down. You look at what it is for the week and where we are now. So explain to us what we're looking at here. Is that Ms. Lorna?
Hi, good morning, yes. Yes, Marlene. Actually, to get a better picture, because data changes from day to day. Yeah. So looking at rolling averages is the best way you can take a more you get a clearer picture of how the trend is actually going. So in the graph that you had shared, it is showing us that consistent decrease. I think it was from, if you look at, this was from October, it's a 3-month from October to, this one that you have is from October to, January, 24th of January. If you look at that, you can see that consistent decrease of the rates of infection here. When we're looking at the positive cases, since like about week 50, we call it 50 to 53, you started to see that steady decrease, and up to this moment, that rate has been going down. So has been consistent then, because at other points, you had some increases, then it decreased, then you see an increase again. But this has been consistently going down.
Yeah. And that is kind of the similar pattern you'd see when you talk about new cases that are detected. But when you look at the transmission rate, that fluctuates differently.
Yeah, the transmission rate, it has a lot it depends a lot on how many people we are testing.
Yeah.
How many people are being reached, how many people are testing positive on any given period of time. So when you look at the R0 that we call it, or the R0, or people refer to it as RO sometimes. Basically, what it is telling us is the rate of transmission. How does one positive case affect how many other people it affects? And for you to say that you're successful, you usually want to be below 1. When your R0 value should be below 1 consistently. At the moment, we are at that point. And I think across the country, most districts are below 1.
Okay.
Of course, you want to go below 5. At some point in time, you want to keep it below 5.
0.5.
If you look at community from community, some of them already have that. The national one here that you're looking at, if you notice, it's I think it's 0.7, if I'm not mistaken. The national reproductive, when you look at the rate of transmission.
Yeah.
So we still need to go.
Just Lorna, if I could, to break this down further, what this means is, if we look at the first part of the chart is November 1st. So in early November, you were looking at every positive person passing on COVID-19 to 2.5 people. That's what the numbers say, 2 to 3 people.
It was way above 2.
Wow.
So every positive was spreading at that rate.
Right.
Now where we are is that every positive is spreading to maybe one.
One person, yeah.
Yes. And you see that gives you that break to catch up, because whilst you are following one person that is infecting 2, 3 or more persons, then by the time you find those 2 and 3 would have already infected other people.
Yeah.
But while you have that, you're infecting just one person or less than one person, when you look at it from that perspective, then it actually is giving you the opportunity to find those persons and close the gap for transmission. And that's what we want. You want to be able to detect as soon as possible to break that transmission.
Yes.
And that is the reason for that expanded testing. Because right now what you're looking at are what we call the silent spreaders. These are the asymptomatic persons that are out there that do not know they have it, and unknowingly might be transmitting the infection. So that is where we want to go. We want to reach these people, to identify them early, and so that we can break that transmission, that chain of transmission.
Yeah. So beyond looking at how far we've come in Belize with getting the transmission rate down, in looking at new positive cases, I know we must gauge ourselves and the work that we've been doing based on how people around us are responding as well. When you look at the data from CARFA, we know that Belize still stands out with the number of cases that we have, and also a very critical point. You're talking about over 300 families that lost loved ones, which is a very high number for such a small population. Let's talk about how you interpret them as the Ministry of Health.
Okay, so when you look at this graph, if you notice, we are, when you compare ourselves to Guyana, Haiti, and Jamaica, we're up there in detecting cases.
Yeah.
So we are finding all these cases, but you also look at how many of the recoveries, which is the little blue dot there.
Okay.
It is telling you how many recoveries we have and looking at the active cases. So in that area, we have done, again, as I said, we have done well in that the recoveries now are getting smaller. If you look at Jamaica, from the blue dot to the top of the pink line, that is the active cases that are remaining. With us, it is a bit smaller.
Yeah.
Again, the incidence, this is, again, as I said, when you look at the incidence or the new cases that we're detecting on a day-to-day basis, the rates, which is the green line to the back, the green graph to the back, you can see we are a bit lower.
Yeah.
Of course, if we compare ourselves to the rest of the Caribbean, we're doing somewhat well compared to these other bigger islands as such. But locally, I mean, we really have to keep ensuring that our numbers are kept down, because as you rightly said, when you look at the mortality, that is when any life lost is a loss.
That's
A huge loss for
one life
any
is too
country.
much.
So definitely, whilst we are having a high recovery rate, we also want to decrease our mortality rate. So it's timely identification of the cases so that these cases can be managed and avoid the complications that come with COVID.
Yeah.
Dr. Diaz, maybe you want to shed some light here. So I hear what you're saying, that there are multiple efforts that are ongoing at this time. You're talking about trying to keep your incidents down, less cases being detected, getting asymptomatic people out of public circulation or interaction as quickly as possible. What's the targeted approach for reducing mortality? And if I could just use an example that I know, we've had many COVID patients who've recovered on the show. And one of the things that we've heard very clearly is how quickly one's health can deteriorate without them even knowing. So they end up going directly into a critical situation when they reach the hospital, which increases the chances for death.
Yeah.
So what's the approach from the Ministry of Health in being able to tackle this singular issue?
Yes. Well, like you quite rightly said, initially determining early who is infected and stopping the spread, that definitely is one of the biggest approaches that we can have. If we are not spreading, we will not get severe disease. Secondly, ensuring that persons do come to the flu clinics and do access care if they're symptomatic. Many times the symptomatic relief like Tylenol, ibuprofen, rehydration, all these things help for a person to get back on their feet early. Many of us have had the flu virus, for instance, and we know that you feel weak, you're exhausted, you lie in bed a lot. So all these things can lead to complications like a pneumonia, difficulty breathing, dehydration. So we appeal to the public to access care early, to get medications that can help them to manage some of the symptoms and to try to remain as active as possible. So these things will help initially. So definitely when we started to give out what we call the flu packs at all the clinics for everybody who was swabbed and relatives, that had helped a lot. And in addition to that, persons who were living not in close access to health facilities were very content and happy that they were able to get some of these medications just when they visited the clinics. So that again is another area that has helped us to improve the patient symptoms. But also we have strengthened a lot of the management in hospitals. For instance, in our regional facilities, we have done a lot of training with regards to using the high flow nasal cannula. Equipment has been placed in hospitals. Standardization of care has been implemented, where if a patient shows up to Northern Regional, Southern Regional, the internists, the medical officer, the nurses, everybody have a protocol that is followed. And in that manner, I think that we have been able to at least try to reduce the mortality rate in our country.
I'd like to go back to Ms. Lorna, simply because of the surveillance part of this thing. What are the hot spots right now within our country with an active count of about 286? Where are the hot spots?
Sorry. Yes, actually, these cases are spread across the country, but definitely, if you just look at numbers, the Belize and the Cayo district have the higher numbers or the active cases. We found that when you looking at a particular district, you have communities that might be reporting more cases than others. So you find that the city itself in Belize City has the higher numbers compared to the rural areas. And similarly with Cayo, you find that Belmopan and San Ignacio are the areas where you have most of these cases coming from. So if you look at this current moment, you find that it is within a particular area. If you look down south, for example, in Toledo, they're still having like clusters because of extended families that they have. You find that if somebody is infected, then when you see big numbers being reported out of Toledo, those are just like a family. So these are clusters that once they're identified, it's tried to be cut at that point. So identifying the case and quarantining and isolating positive persons is the approach that we're trying to implement as soon as possible. In the north, it's sporadic cases now. And it is just through, as you said, through active surveillance where our officers are out there looking out for these persons to identify them. So the fact that you have 200 plus active cases that we have detected, you know that there might be some others out there who are asymptomatic and are not aware of it. So these are the target right now is trying to identify these persons through active surveillance, which means we actively are going out there trying to find them. But in regards to hotspots, as I said, it's mostly urban than rural at this point in time.
Let's shift gears for a bit, and we got to get to that vaccine conversation because I know that's what everybody is patiently waiting on. But let's break from what we're talking about with the current situation to talk about what we do when and if the new variants are detected in Belize. Let's start off with what we know about the tests that have done so far, and just frankly, why is it taking so long to get the results?
Yes. Well, in Belize, we can't, and in many countries, the genome sequencing cannot be done.
Yes.
There's a lot of different equipment and specialized equipment to do the genome sequencing. So as I had mentioned before, we had partnered with Baylor College in Houston. So they do have about 300 of our swabs at this point. And CARFA also has 10 of our swabs, and that's the quota that they give different countries different quotas, and Belize has been given 10 swabs a month. So we've kept in constant contact with Baylor, and they are in the process of doing the genome sequencing, but they have asked us to give them another week or so in order for us to get some of the preliminary results from the swabs that they currently have. So it's just waiting to hear, and hopefully, I actually spoke with the doctor in charge yesterday, and she said that definitely it's ongoing, and they will have some preliminary results for us very soon.
So we've not gotten any tests back on strains so far?
No, we have not.
So does that, these samples are taken from what, a week, 2 weeks ago?
Yes, well, we constantly send, every week we package 10% of what has been done, and or less. We only started to send about 2 weeks ago, and the initial samples that were sent were smaller groups, 10 or 15, and recently we sent another 270 something swabs, and they have confirmed that they have received it. And there is a process that has to be done as well. So she was explaining the similar processes with extracting the virus from the swabs and storage and doing other processes in order to check for the strain. So we are keeping in constant contact with them. and with CARFA, and we do hope to get some results very soon.
So, I think if and a lot of people follow what's happening in other parts of the world, we know that there is great concern when a variant is detected because of how quickly it can spread. So let me understand this. If we get a positive result for either one of the variants, the UK variant, the South African variant, the Brazilian variant, that would mean that it was from 2 weeks ago. So the potential for that spread to have taken place would be very concerning, I'd imagine.
Yes, well, when we get our preliminary results or any results, if we do have a positive case for one of the variants, this would be somebody that has already been detected as positive and is isolating. So hopefully we would have ensured that there's no more transmission at that point for that person or the family members for that person. So we do have a plan of what we will implement if we do have one of the variants, especially the UK variant that is 70 to 80% more infectious than the other strains.
Wow.
So it's basically ensuring that persons who are positive are well isolated. We do follow-up checks on everybody who is positive. We are ensuring that we're doing the health education and reminder to the families, and we're doing our contact tracing as well. So whoever that person is residing with or the workplace, etc., we would have gone in and done very thorough contact tracing as well.
That leads me to ask the question, but before I do that, last year when they announced the reopening of the international airport, there were a lot of naysayers simply because we didn't know what to expect, and we know that especially when it comes to tourism, we've got a lot of American tourists come to Belize to enjoy what we've got here. What are the numbers coming out of the international airport, if you're at liberty to share that with us? Are you?
With regards to the swabs?
With regards to testing and if there are positive cases when tourists come to Belize, what are the numbers, if there are numbers coming out of that?
Yes. On average, I have it here, but on average, I think we have detected about 30 persons so far from the airport. Ms. Lorna, you could correct me. And we have done almost 7,000 swabs since the airport has opened.
Okay. Well, because some people also come in with a negative test as well.
That's right. So we do accept a negative PCR test that's done within 72 hours or a negative rapid test that's done within 48 hours. And there's also some screening that occurs at the airport. Persons download the health app. We know where the tourists are going, their temperature checks, and a short questionnaire when the persons are passing through the airport. So we do have that data and that information. And they've got to present the test, and they are seen by our doctors and nurses at the airport prior to giving the clearance.
All right. So we've gotten quite a bit of information from you so far. One, that the mass testing is a part of the strategy to reduce the amount of transmission that we're seeing. We are doing much better than we were 2 months ago, but it's not a moment to stop and celebrate. It's just a matter to keep on working. You have a plan already created when there is a detected case, or if there is a detected case of a COVID variant in Belize, that it sounds will go into effect immediately after. So let's talk about the big one, vaccines. When are we going to get them? Where are we going to get them from? And how many are we going to get?
Yes. Well, as was mentioned before, and it's public knowledge, Belize signed on to COVAX facility, and this is a part of WHO, and it was created in order to ensure that there is equitable distribution of vaccines to countries that may not be able to purchase large amounts. Belize signed up to COVAX to get 30% of our population vaccinated. And this equates to approximately 120,000 persons, which is about 240,000 vaccines. So we do know that this is in the pipeline. We've made our down payment, and we're waiting on that. And we have been in constant communication with COVAX, and we do know, well, we have what they term an indicative allocation letter that a lot of the Caribbean and Central American countries have also received over the last week,
Yes.
saying that the process is now very much near. Within 4 to 6 weeks, we will be hearing more from them with regards to the final allocation amount for the first phase of the vaccines that will be sent to Belize. And we have been given an estimated time of the end of March, early April to receive that first set.
And that first batch, do we know what vaccine it's going to be? And as far as it's been explained to us, it's actually only going to be a percentage of the 30%, something like 3%,
Yes.
we're told?
Yes, that's right. What COVAX has explained to us is that they will send us the vaccines in different phases. They haven't really clearly stated how many weeks in between, but definitely there are 3 phases for the 30%. And they will let us know over this week. We hope to get the final allocation letter before Friday. And in that letter, they will outline exactly how many vaccines will be coming on the first shipment. The vaccine that is stated in the letter is the AstraZeneca vaccine.
Okay.
And do we have the capacity for storage and administration for these vaccines? That's always been a part of the preparation phase that was necessary.
Yeah.
Yes, for AstraZeneca and all the other vaccines, yes, we do. The one that we don't have the storage facility for is the Pfizer vaccine that needs to be stored at -70 degrees.
Wow.
So that's some investment that we have to make, and we have made the decision to go on to make the investment into the freezers, just in case we do get the opportunity to get some of the Pfizer vaccines. We are prepared and ready to accept.
All right.
Is the access to vaccine, are we only looking at the COVAX facility as or sole access to vaccines at this time?
No, not at all. With COVAX, it was 30%. So in order to achieve herd immunity, a country needs to vaccinate 70% of its population, at least 70% of its population. So we still need to look for 40%. And we have been actively working on this. We have discussed bilateral agreements with 2 companies already, and we have also sent out letters and have been in discussion with about 5 other countries in order for us to try to procure vaccines in that manner. So many of them are very hopeful. So I do believe that we would be able to get the other 40%, either with bilateral agreements, which we don't have any bilateral agreements signed as yet, but we're constantly in communication with these companies, or by other countries that we have discussed with recently.
And when you, I mean, I'm sure you're hearing the public clamor for when we'll get these vaccines. We have to be very open about what's going to happen after that first batch. If it's 3%, 5%, which is what, 12, 15,000 vaccines. When that comes in country, what impact is it going to have?
Well, the initial letter that we got has suggested that we'll receive a little over 100,000 doses. And that would be received in 2 different phases. So the first phase, we're looking at about 40,000 doses. And with AstraZeneca, the first dose is given at day 1, and the recommendation for the second dose can be anywhere from 4 weeks to up to 12 weeks. And in fact, more efficacy is achieved if given in the latter time period. So we are looking at the first dose on day 1 and the second dose on week 8 to week 12. So we will ensure that as many persons as possible would be getting that 40,000 of the first dose of the 40,000 vaccines.
Oh, okay, that's interesting. I thought it was going to be that you would do 20,000 with 2 doses, but you're looking at hopefully getting a second batch within that 12-week span.
Yes, absolutely. And then the second batch is the bigger amount. So we would then be able to roll out to even more persons.
Okay.
Wow. That is interesting.
Yeah.
But looking at, I think we feel sometimes that once we get the vaccines that, that gets the ball rolling to get us back to what we knew before 2020, what
That's
our life
normal.
was like. And is that the case?
Well, I do want to stress here that the vaccines doesn't necessarily mean that, well, of course, COVID is not over. And not everybody in the first 2 to 3 months will be vaccinated. It takes time to get the entire 70% of our country vaccinated.
Yeah.
So definitely it is not that this is the end to COVID. This is the end to public health measures. The changes that have occurred over the last year will continue and must continue this year in order for us to get over the morbidity and mortality that COVID has caused. And the vaccines will also help to reduce the severity of the disease and help to reduce us infecting other persons as well. So the impact might not be felt immediately, and definitely we at the Ministry of Health and Wellness, we want the general public to know that even when vaccines come to Belize, this is not the end of the measures that we have to take. We've got to continue to be responsible. We've got to continue to protect our vulnerable population, and we've got to ensure that we practice the safest measures as possible with or without the vaccines.
All right. Well, you're breaking it down for us there. And let me quickly get back to Ms. Lorna in terms of surveillance, or as a matter of fact, where in your municipality you're able to get testing in the event you're feeling like you're actually having some symptoms.
Yeah, definitely all districts are providing testing. They usually, again, as I said, within the health facility itself, you can get tested any day, every day. When you see it announced in your community or in your neighborhood, we would encourage you to get tested. The idea is to know your status. I remember when we were campaigning for HIV, Know Your Status campaign. I think we have to go in that direction again with COVID. If we have the opportunity to be screened, then I would encourage anybody that might have been exposed, that they think they have been exposed or that they're having any symptoms, to come in and get tested. So it is available at all public health facilities. If you want to go private, there are the private facilities that are also offering rapid testing. But from us at the ministry, all our public health facilities do have access to the screening tools there. So you just have to go to any of our health facilities and seek the services. And I want to encourage everybody, again, as I said, when our testing team goes to your facility or to your community, to take advantage of it. Remember, you might be asymptomatic, but if you think you have been in contact with somebody who is positive, or somebody in your neighborhood has tested, or at the workplace has tested positive, then just take advantage of the services and let us help and keep the numbers down and take it further down.
Yeah. But is it as simple as showing up? Like if I just go to the clinic today and say, I think I've been exposed, or do I have to get, confirmation that I should get tested?
You go through a screening process.
Okay.
To identify your risk factors. But at the moment, as I said, we are not overwhelmed as we were at some point when we were having hundreds and hundreds of tests being conducted at any point in time. So at this point in time, I don't think there is any reason that we can turn you back if you think you have been exposed.
Okay.
You no longer have to go through the strict screening process where we had to determine whether you warranted a test or not. So at this point in time, we are implementing some level of random testing. The methodology right now, as I said, is looking at the high-risk areas. And if you're within that high-risk area because of the heavy traffic of people that you come in contact with, then we encourage those persons to get tested.
Okay. Wow.
All right, so last chance for a public plea.
Yes.
While we can say that the numbers are looking promising, what do you need from us? What must we continue doing?
Yes, I think that the message has to be that we've got to continue to practice to be responsible, to ensure that we protect the elderly, protect the persons who are diabetic, hypertensive, asthmatics as well, pregnant women as well, because these are our vulnerable population.
Yes.
We need to not let our guards down. The response against COVID-19 is not just a response from the police or from the Ministry of Health, but each of us as individuals have the responsibility to ensure that we reduce the spread and that we continue in the direction that we're going presently. Even more so, like you said, that if we are not certain what strains are here, but we do know that if we possibly have COVID or symptoms of COVID, we stay isolated, we go and get tested as soon as possible, we get our symptomatic relief from the health facilities, and we ensure that we are strict with our isolation. And in doing these things, it will really help our country to continue in the downward trend. And I just want to appeal to the general public that when we do get our vaccines, that when your turn comes, you do access these vaccines.
Yeah.
It is one of the best ways that we'll be able to control this pandemic. It's a global response. Every country has to be more or less doing the same thing with regards to the vaccines. And we want to encourage the general population to ensure that they come out when it's their turn and get the vaccine.
Doc, finally, before you go, when it comes to the healthcare workers, we previously heard that there were a lot of them getting infected. At this particular point, where are we with that?
Well, it has been very positive for us. We haven't recently had any clusters or outbreak in our health facilities. And that comes, the reason for that is that we do a lot of health education. We ensure that we do a lot of the infection and prevention and control measures in our health facilities, and as well with the number of cases going down as well. As Ms. Lorna said, we're not as overwhelmed as before with hundreds of persons coming in who are ill. So all these things have also helped us to not have the infection spread in our facilities.
All right, great. And Lorna, last question for you. Is there heightened surveillance in Corazon with the opening of the free zone?
Yeah, definitely. That has happened. Actually, over the weekend, they had the screening of the employees just to have that baseline. Where are we with the opening of the free zone? And our team there is at that heightened level indeed. And so the monitoring is ongoing. They have structures in place now and processes in place to ensure that we have early detection, because we know that the potential for infection is high, so we have to step up our surveillance in that aspect and ensure that we detect early and intervene early.
All right. Well, thank you guys so very much for clarity for this morning. Great conversation, and especially spreading that message across the country that everybody should still adhere to all the protocols from the ministry. Thank you guys, and have a lovely and warm day.
And
Thank you.
safe.
Thank you so much for having us on the show.
All right, so we're about to take that break. When we come back, we'll be discussing Scouts. Did you know that February 1st to the 28th is actually being celebrated as Scouts Month? Well, they'll tell us more about it when we come back. Stay with us.
This COVID update was brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.